something else that's not going away anytime soon is, since we've been on this show, to another piece of breaking news is the U.S. has hit 400,000 COVID deaths.
Wow.
400,000 COVID deaths due to, of course, a government, a federal government that has not responded or taken this seriously, and definitely not in time. And of course, state governments who have not taken this seriously and have played politics and economics. Let's play this real quick, this clip of CNN, which describes the individualistic competitive system of trying to get a vaccine now for COVID in the U.S.
Is going on with vaccinations in this country? I mean, I think there's a lot of confusion out there. I mean, the Trump administration failed to meet its own repeatedly reduced targets for vaccinations. But then you hear someone like a Dr. Fauci say, listen, it's not as bad as it sounds right now. Where does it really stand, and are things ramping up?
You know, I think trying to gauge if it's as bad as it sounds or not, you really have to talk to individuals. I mean, I certainly know people who got a vaccine relatively easy, friends of mine who are doctors or nurses. But I know people who are trying to get shots for their parents or grandparents. They are on the phone. They are online. They are trying their hardest. These are smart, resourceful people, and they can't do it. It is chaotic. In other countries where I talk to folks I know in other countries, you pick up the phone, you call a central number, you make an appointment. It is not that complicated. Here, it's really, it's every guy and gal for themselves, and that is really difficult. And so let me show you what those numbers, what that amounts to. So far in the United States, about 31 million doses have been distributed. In other words, have been put around the United States in various locations, but only 12 million have been administered. So 31 million distributed, but only 12 million have gone into arms. Poppy, Jim?
We have 350 million people in this country. We're in great shape, guys.
I really wish she said why her friends in other countries were not experiencing this, right? Is because other countries around the world have national healthcare systems that have mechanisms to distribute the vaccine, right? And that we don't have national healthcare, which is the consequence of the last 40 years of the destruction of public infrastructure from neoliberal austerity politics. It's not like, and the whole, like, I mean, it's amazing how little people in this country, especially the news media, look externally and look at other countries. But when they do, they give just no context at all. It would just be, it's the best case. I mean, not to beat a dead horse about the case for Medicare for all, but it's also worth pointing out that the disaster of the rollout for the vaccine here, when you think about the disparities in this country, think about how it's going to shake out for the global South around the world. Global Justice Now is currently working on a campaign around that because the pharmaceutical companies globally are going to absolutely screw this up for the whole global South.
Of course. Napoleon, I mean, this is, we're a global embarrassment. We're banned from going into Europe or Canada. Because we haven't been able to take care of this COVID situation. Arizona, I believe, last time I checked, has the worst COVID cases in the world. Wow. Just to put this in comparison, I was looking at globally, how other countries are dealing with it. The highest populated, most dense country in the world is Bangladesh, and they're doing so much better. Even with tremendous poverty and government assistance being weakened there. And it just in terms of how many people are in the country. But then you look at Arizona, and then soon afterwards is California. California, a progressive state, Arizona, a Republican state. I mean, this has gotten so out of hand. I mean, do you believe Biden says that he's going to start vaccinating 100 million people in the first 100 days? And I really hope so. But if we don't have Medicare for all, if we don't have properly funded hospitals, how are we going to be able to distribute these vaccines in time? And if people don't even know how to get them?
Yeah, I mean, I think it's definitely an opportunity for all of us to start talking about, universal health care because of that issue right there. That's the elephant in the room, like Joshua said, that they don't seem to want to mention. It's working better in other countries because they have these systems in place, because they have this infrastructure. We don't. And on top of the strategic failure of handling this crisis by the Trump administration, where they should have had a centralized strategy for all of America. Like, it should be a website. You take your appointment, they tell you where to go, you show up, you get your shot, and then you keep it moving. But obviously, I'm hoping Biden will try to take care and do a better job for the sake of lives being saved. However, we need to go to the root of the problem and keep informing people that the problem can be fixed with national health care. Like, we wouldn't have that. And this is not going to be the last pandemic we're going to go through. This is like the test run for the next one. So we need to get it together now and start getting it together now and not later. And we're in a crisis. We're in a crisis. We got to act like it, and we got to fix these things. We cannot try to patch these problems here and there. It's going to go out of control.
It's interesting that in New York, during the smallpox outbreak 60 years ago, do my math here, they were able to distribute vaccines within 2 months to 6 million people. And I believe it was even under that, to 6 million people in New York. And the population was more or less equal to what it is now in New York City. That's amazing. That's amazing. And that was, by the way, without nationalized healthcare. So it's not just that we have a problem without having Medicare for all. And of course, the injustices, it's also that we're not distributing them properly because, maybe it's this free market competitive, this Pfizer versus this company, and they're bidding, the contracts between the governments. It's as much as we're fans of decentralization, decentralization works when you're starting at an equal playing field. You're not, all of these governments have their own interests, right? Including the people who lead them, whether it's DeSantis or Ducey or Cuomo or Newsom, they all have their own interests that they are aligned with. And it's framing how they deal with this crisis from day one. We saw it with the nursing home crisis in New York. Cuomo can go around and sell all the books he wants, taking credit for solving COVID. But the reality is 1 out of 5 New Yorkers got COVID in New York State. Anyways, sorry. Let's end this on a bright note. Tomorrow's inauguration, everybody. Thank you, Joshua Kahn Russell and Napoleon DeLegend. For our audience, we are going to be doing special coverage tomorrow. It is going to be a 2-hour show covering the inauguration. We start at the same time, 3 o'clock Eastern, going till 5 p.m. Eastern. It'll be so much fun. We'll try to air whatever we can live. I believe that the speech will be done by then, but definitely check it out. We're going to be doing all the coverage. Thanks for watching and listening to The Nomiki Show. But remember to click like and subscribe on YouTube, and please share on social media. If you're not already a patron, please join us for as low as $5 a month on patreon.com/The Nomiki Show for early and special content. That investment makes a huge difference. We are not corporate media raking in the dough. It's really you guys that are keeping us going. So please consider being a patron. And to our current patrons, thank you so much. We are incredibly grateful to you. We also now have swag. So check us out on thenomikishow.com to get your mugs, your totes, and your stickers.